Welcome to the platform Swiss Liver Patients Association, Swiss HIPAA. Today with Professor Beat Müllhaupt, Vice Chair Clinic Director and Head Physician in the Clinic for Gastroenterology and Hepatology at the University Hospital Zurich, with the topic Primary Biliary Cholangitis. Welcome, Professor Müllhaupt. My first question, what is PBC?
PBC is a chronic disease, a chronic inflammatory disease that mostly affects the small bile ducts in the liver, and that can lead, if untreated, over years to liver cirrhosis.
What is life expectancy?
This largely depends, obviously, when the disease is recognized. If the disease is recognized at early stages, the prognosis of these patients is today very excellent. However, if the disease is missed and is only diagnosed at the stage of cirrhosis, which should not happen anymore in these days, obviously then the life expectancy is certainly decreased.
What are the symptoms?
Today, most patients, or a lot of patients, are actually diagnosed in an asymptomatic stage where they don't have any symptoms at all. We just find liver values. Classical symptoms in PBC patients are actually pruritus, which is very debilitating for the patients, and fatigue. We have sometimes also symptoms which are associated with other diseases, such as diseases that affect the joints. So joint pains can be a problem. We have diseases that affect the salivary glands. So dry mouth, dry eyes can be a problem. So it's a very heterogeneous presentations of these patients.
How can PBC be diagnosed?
PBC is mostly diagnosed today with elevated liver enzymes, the so-called alkaline phosphatase or gamma-GT. These values are elevated. And then if we find also antibodies, autoantibodies against mitochondria, the so-called antimitochondrial antibodies, we can very confidently make this diagnosis.
What are the causes of PBC?
Unfortunately, the causes are still unknown. We know that obviously sex plays an important role because most patients are female. We know that there is some genetic background to the disease, as we also know that monozygotic twins have a very high risk of developing the disease. We know that there is some familial clustering, but there must also be other factors, outside factors, which are discussed, which are not completely clear. So sometimes infections can be associated with PBC. Smoking is always discussed. Also, this is a little bit controversy, whether smoking really leads to PBC or not, or increase the risk for PBC. The same is true for cosmetics. In some studies, cosmetics have been associated with PBCs, in others not. But overall, we have still to admit that we don't know what causes this disease.
How is PBC treated?
PBC is treated with medications. The current gold standard for treating PBC is a drug called ursodeoxycholic acid. It is a bile acid that's normally present also in very small amounts in humans. It's coming from the bears. It can be produced synthetically, obviously. And this is a very efficient drug that can improve outcome, improve survival, can improve symptoms, and has very few side effects. So it's actually an excellent drug.
How widespread is PBC?
PBC is still a rare disease, although we have noted that there is an increase in industrialized countries with PBC, but it's still a rare disease with a couple of cases per 100,000 people.
Who is at risk from PBC?
I mean, this depends on the stage of the disease. If we can diagnose the disease at early stages, we can prevent progression to cirrhosis in most cases. So these patients have an excellent prognosis. We have to recognize some of the complications of the disease, such as osteopenia or osteoporosis. Therefore, it's important to perform bone density measurements early on and then in regular intervals. It's important to supplement, if necessary, vitamin D and calcium. If osteoporosis is already present, to try to prevent it with drug treatment. It's also important to measure vitamins, especially the fat-soluble vitamins D, A, are very often reduced, and they can be supplemented in a very easy way, and they help to prevent complications of the disease.
There is a German BBC register. Is there a BBC register in Switzerland as well?
There is a study under the auspices of the Swiss Association for the Study of the Liver, the so-called SISL, which has a registry for all autoimmune liver diseases, and one of the registries is actually specifically for PBC.
My last question, as a specialist, do you have any advice or recommendations for patients with PBC?
I think most PBC patients can live a normal life. They should try to prevent further liver damage. They should avoid excessive alcohol consumption because this would add to liver damage. They should try to avoid to get overweight or obese because also this would then be a second factor that can affect disease progression. But I think otherwise PBC patients can live a normal life. And I think it's also important to know what is mostly young women that also pregnancies are without increased risk for the newborn or for the mother itself.
Thank you very much, Professor Müllhaupt, for your understandable and helpful interview, which can be an additional important source of information for patients. Thank you very much.
You're welcome.